inspiring morning. Everyone hear me?
Yeah.
What a daunting task to follow such a lineup this morning. In fact, I think I'm having chest pain. Shortness of breath. Someone call 911. Well, I just want you to imagine with me being sick, feeling really bad, just gotten discharged from the hospital. You're afraid, you're alone, even though you have some support at home. No one really understands your problems. And you're also worried about the cost. I mean, it's bad enough to be sick, but then to have this huge amount of cost associated with getting better, if you get better, is very, very intimidating. So I want you to imagine with me that you're sick, you just got out of the hospital, and you call your physician's office. After you navigate the phone tree from hell, we've been there, you either are put on eternal hold or you're leaving a very wishful voicemail. When you finally get a live voice, you're asked several different questions by several different people, all the while being put back on hold, and everybody gives you several different answers. No one is connected. Someone said it earlier, communication is the absolute key to breaking these barriers of fragmented and siloed care. We're long overdue in the health profession. So you finally arrive at the office, and you find out that your hospital records aren't there. You just got out of the hospital. They don't have your records. So, you wait an additional 30 to 45 minutes of your valued time so they can obtain your records. When they finally get your records, your physician rushes in the door, says, "I'm in a hurry." Really? And he then begins to wonder why they changed your medicines. He had you on the right medicines. So he changes them back. More affordable changes. More worries. More ambiguity. Your anxiety is certainly getting worse. And so then he has to tell you that you really didn't need to see him. That who you needed to see was the specialist. The one that actually is suggested in the discharge summary. So you go to the front desk and they say, "You called the specialist and set up an appointment." We're not. And oh, by the way, have a great day. You're supposed to laugh. I'm a serious cardiologist, but I'm not. Now, imagine now, with me, what it could be like. You make one phone call or one email, and a virtual map of healthcare unfolds. Your map. Not my map, not the population's map, your map. No longer is healthcare that intimidating, frustrating, complicated procedure that pushes many of us away. A very compassionate, informed care navigator answers the phone. And she proceeds to lay out a clinical path just for you. Not only that, all your clinical information, up to the very night before, is available to every medical visit you're to make. Wow. That's what information technology will do for us. That's the difference in the mid-90s and now. And I understand nothing about it, but it really works. Evidence-based medicine guidelines are recommended for you to follow for your illness, your problem. A diagnosis is made, and guess what? Somebody actually tries to answer your questions. All the while, this is done by a multidisciplinary team approach, not just the doctor looking down. but a level playing field where everybody is important. The care manager, the physical therapist, the social worker. They're all important. And they're all going to make a difference in your recovery and your faith and trust in the healthcare system that is very broken. If hospitalization is required, you'll be admitted under a patient-centric model. Everybody is working around you. And you'll be discharged in a very safe manner back to home. If necessary, one of our care managers will call on you or come even visit you. House calls? They're back. I love it. And they'll make sure that you got home safely, that you have the right medications, that you're actually taking them. You're not taking what Dr. Oz recommended. And you have appointments set and arranged for follow-up. You close the gaps. Gaps are safety problems. Gaps are problems that create more problems. We need to tighten the communication around the patient. This is what Triad Healthcare Network is all about. That's our whole concept. It's really about patient-centric care and service. And guess what? All the while, we are going to reduce cost. Wow. You say, how in the world are you going to reduce cost? I'm going to tell you. But first of all, I'm going to tell you how broken healthcare is in this country. You already know this, but I'm going to give you a few facts. Last year, the United States spent close to 17% of gross domestic product on healthcare. All the while, we showed no better outcomes than any other developed country who spent half that much. Wow. Fragmented, redundant health care that is not focused is very, very expensive. If we want our healthcare system to remain as accessible and as good as it's been in many areas, something has got to radically change. We have pushed our doctors very hard. I'm a doctor, but we're under a lot of scrutiny now. We're under a lot of regulation. More paperwork, more electronic medical work, less face time with the patient, declining reimbursements, increased liability, increased overhead. And it's at this very time that the responsiveness of the physicians in this community has been absolutely astonishing. Astonishing. The visions of this actually began in those conversations that the preceding speaker said. Oh, by the way, conversations in the hallway of the hospital between lead physicians in the hospital. How can we develop a different delivery of health care that actually works? The Patient Protection and Safety Act actually served as a catalyst to get us up and looking at this. We selected 20 physicians in this community. No one turned us down. They were chosen based on the fact that they were respected doctors, they were good doctors, other colleagues, that they were community-minded, they were patient-centric, and they were willing to throw their egos out the door, or hang them on the door, and come in and actually work through some critical conversations to get something to change. We started with just simple building trust. Because there's been a lot of bad trust in this community and other communities, if you talk to other people, between the hospital and doctors. It's all about protecting my turf. Well, the turf has got to go away. And we quickly realized that's the way we were going to have to deal with this problem. We had to build trust and we had to build relationships. And that's been the most beautiful part of THN for me. without a doubt. I could care less how we get the results, as I was telling a colleague this morning. I really want to see the wonderful outcome. So, we solved problems, we moved forward, and then, oh, by the way, we became a clinical entity in July of 2011. This is a very short period of time, guys. In January of 2012, we found ourselves in a position to actually apply for CMS, or Medicare's Accountable Care Organization. January. The deadline was March 31st. We had no idea we'd be there. We were there. It was amazing. Tremendous teamwork. And doctors were ready. 2 or 3 years before that, they'd have said, "You're crazy. This ain't going to happen. It's fee for service forever. Go back to work." We wanted to recruit 100 primary care physicians in 10 weeks. In 5 counties, that was our goal. We recruited 170 in 10 weeks. In 5 counties. Now we have 231 primary care physicians, including pediatrics and OBGYN. And we have over 500 specialists. Amazing. I mean, I was absolutely stunned. So, we get approved. And all of a sudden, it's like a wow moment. We have 40,000 patients we're now responsible for. Accountable care, by the way, means population risk management. You're doing comprehensive management of a large number of patients. Okay? And now we've done other contracts, and we have close to 75,000 patients. And this is going to grow very quickly. This is happening month by month by month. When we analyze our data, this is the best part of my story, we found that just 2.5% of those 40,000 patients were spending up to 18% of the total dollars. Did you hear that? 2.5%, 18% of the dollars. So, we said, what is it? Well, it's very obvious with our information technology. We ferreted out the fact that they're using the hospital ED as their primary care doctor. In fact, many of them don't even have a primary care doctor. Or they're being hospitalized over and over again because they're not compliant. A huge factor going forward is going to be accountability, not just for physicians and payers, but for patients. It's got to be that way to survive. So, let me give you a dramatic example. This will touch your hearts, I hope, because this is what it's all about. We identified this sweet little lady among those thousands of patients, and she was facing life alone, literally. She had been in the emergency room 132 times in 1 year. She didn't go to the same ones, she went to different ones. When we visited her home, it became very obvious why 911 was her primary care provider. Okay? She lived alone. She did not have her meds. She had not been out of the house for any socialization in 2 years. Needless to say, she hadn't been to her primary care physician in 2 years. She was in a wheelchair. She had no food in the refrigerator. She was on insulin for diabetes, which wasn't refrigerated. And she, when she got in trouble, she had chest pain, she had shortness of breath, whatever, she was calling 911. That was her way out. It was her way out. And the last thing I meant to say, she didn't have a handicap ramp. So, we got involved, we got her meds, we got her appointments, we provided transport to her primary care doctors and other doctors. We built her a ramp, we got her a refrigerator. Wow. Guess what? She has not been in the emergency room again in 4 months. 4 months. Isn't that a great story? But I'm going to tell you the really good thing about this, because we all have to pay these bills. You know, we're paying bills. We're paying for other people's health care. So we have to be responsible as healthcare providers that we're spending your money wisely. That one case will save over $250,000 in 1 year. One patient out of 40,000, 250,000. So you could honestly say that this is more than just healthcare. And that's been the fun thing about this. So, you say, how can THM pull this off? I'm going to make this very simple because it has to be simple for me to tell you. I don't understand all the wires and the technology and the nanoscience and all that stuff. But I do understand when I see data, and I know how to use data to better track and manage patients. So, we have a health information exchange system which connects every single doctor and every single hospital that a patient in our network will use. And every time they go see a physician or go to a hospital or emergency room, you get a claims data. Okay? Everybody gets claims data. And we can actually see with one click of a button where that patient's been over a several year period. Not only can we see where they've been, we can see the results, the lab data, the CT scan, the MRI. So can you imagine when you go see your primary care physician, and he's going to be able, or she's going to be able, to pull that information up, the power of that visit. The decrease in errors, the decrease in med reconciliation issues, an active, accurate diagnostic list, better care. But one of the things that you need to hear me say is that this will help us with chronic disease management. This will help us with community resource allocation. But one of the things that has to happen is that patients have to be responsible for themselves. Because if they're not, all this is going to implode. And we will be universal plan, we will be socialized, and it will not be good for anybody. So, it allows us to track every single patient. You cannot hide. So we'll know if you got your immunizations that were recommended. We'll know if you got your prescriptions filled. We'll know if you made it to your appointments. We'll know if you got screening mammography or colonoscopy. All these things make a major impact. Wellness and prevention have to be a part of the future. I spoke to the Greensboro employers several months ago. That's the one thing they wanted to hear. Patient accountability. Nothing else. Because they pay the bills. You know, patients are accountable, premiums will come down. Okay? So, what is this going to bring to Greensboro? In my opinion, it's going to bring a change in medical culture that's going to revolutionize the way we deliver health care. And this is also a model that can be tailored to other communities throughout the country. We've already given interviews in California, in New York, in Florida, wherever, people interested in what's being going on with Triad Healthcare Network. It'll allow us, though, to leave a legacy in healthcare, which is very important to me. Because I want to recruit the best doctors, the best nurses, the best health providers to this region, to this area, so that we'll continue to have the kind of health care for my family and your families that we want and desire. And it will clearly attract industry. It will create jobs. And it will meet the growing population needs and diversity of Greensboro. Thank you.